How you guys doing today? It's Anthony Gangi. Welcome to another episode of Tier Talk. So we're back. Today's April 8th, and we're going to do some more updates on the coronavirus. Plus, we're also going to answer some questions from those that watch the show. We have some questions that have come through me through social media, and these questions are personal. They hit home. I am not going to tell you the names of the people that are asking that question, but I definitely think me and our panel of experts here will be able to really explore a few of the questions that were asked. And guys, I did say a panel of experts. Today we have a total of, myself and 6 more, so we have a total of 7 people. And I'm going to have each one of them introduce themselves. And when we come back from our sponsors, then we're going to have a nice roundtable discussion of where we're at with our battle against COVID-19 and coronavirus in our prisons and jails, and maybe provide some tips along the way. But this is going to be a great roundtable discussion that I feel will be informative and just give us a lot that we can learn from. So right off the bat, Lou, what's up, Lou? Tell us about yourself.
How we doing, guys? This is Soto, retired major from corrections, also Rutgers professor presently. I'm just so eager to continue on Tier Talk and talk about this COVID topic. I've been dealing and in the middle of it in the city of Newark, working for one of our private sector's reentry program. So I'm glad I'm here to give you any insight that I can.
And it's always great having you, Lou. Your information that you provide is phenomenal. Very good experience, that unmatched, and just, I don't know, I'm just a big fan of who you are. You know that. Piper, what's up, man? Welcome aboard. First time here. I'm actually a big fan of Piper. We're connected to a great company called Guardian RFID, who really believes in our mission about corrections. They do whatever we can to protect the brave men and women that work in this field. And Piper actually does a lot of training to make sure those men and women are safe, which means he travels across the country, sacrifices time with his family, which is just a sacrifice that I know we appreciate, to make sure that our employees are as safe as can be. So Greg Piper, before welcoming on the show, I also want to thank you for what you do, and thank you thank the company as well, Guardian RFID. I'm a big fan of who they are. But Piper, can you introduce yourself, please?
Sure. My name is Greg Piper. I'm the director of training for Guardian RFID. I've been in corrections since the early 2000s. I started with the Kansas Department of Corrections, worked my way up, started as an officer working the tiers, worked my way up to a frontline supervisor, then a shift supervisor, made it up to a captain's position, staff development coordinator. And then I had the opportunity to travel across the country to go to the beautiful state of Tennessee, where I now live. I spent about 3 years with the Hamilton County Sheriff's Department in Chattanooga, Tennessee, assigned to the Corrections Division, worked in that facility. And then I've spent the last 3+ years working for Guardian RFID, traveled to about 200+ jails across the country, visiting with the wonderful men and women in corrections all over the country, some of the greatest people in the world. And I glean from every jail I go to the best and the worst of everything that I've seen. I grab it, take it with me, and share it with everybody, because I just have a real passion for corrections and for the corrections professionals, for the men and women who do the most underappreciated job there possibly could be. So thank you for having me. I'm very excited to contribute, and look forward to working with all these wonderful people tonight.
Yeah, I'm guaranteeing we'll probably have you on again. And by the way, just another shout out to Guardian RFID. Trust and believe, guys, they're behind the scenes doing a lot of great things for us. So if you get a chance, you could check out their YouTube channel, and you could see a lot of Piper's videos out there. It's pretty interesting what he covers, and also some pretty cool technology that I think may be useful inside your prison or jail setting, detention center, wherever it is that you work. All right, Connie, I'm looking at you now, Connie. What's going on?
Hi, I am Connie Alleyne. I am the founder and president of the Civilian Corrections Academy. We pretty much try to support civilian training needs wherever they need it. We understand that their needs are a bit different than those of correctional officers, and sometimes, the training that we get through the academy doesn't necessarily just help us to navigate what we are going to face as we engage with the population. I'm super excited to be here. As you guys know, I've been on Rikers for 10 years, and then I shifted over to Connecticut Department of Corrections for another 5 years. And from there, I'm now a criminal justice professor at Monroe College. So I'm doing a little bit of everything. I enjoy it, and I'm looking forward to this discussion tonight.
And it's always great having you, Connie. Yeah, the
Thank
information that
you.
you provide is just spot on as well and very beneficial to our audience. So thank you
Thank
for
you.
coming on. All right, Darryl, this is you, brother. Introduce yourself. You have a very big and extensive resume. So what do we got, Darryl?
I don't know nothing. What are you talking about? No. Darryl Smith. I'm the communications director for the International Association of Correctional Training Personnel. I got just about 30 years combined correctional experience, working both in New York and Tennessee, taught at both the academies. And I love working with the corrections and bringing new people and training them up. So thanks for having me on.
Oh, first off, it's always a pleasure. I'm actually a big fan of Darryl Smith because he does whatever he can to make sure that training gets to our brave men and women that work in this profession. So obviously when it comes to training, obviously training plays a big part in our safety and security. So let me thank you, Darryl, for all that you do as well. All right, now we know Brian Kovacs. Brian Kovacs, we go back a ways. Brian Kovacs is on Arizona time. I don't know if anybody, so Brian Kovacs had to rush back realizing that 10 o'clock our time in New Jersey is a little bit different than 10 o'clock Arizona time. But either way, the fact is I was able to call you guys at last minute and you guys making the sacrifice. So, hey, Brian, tell us a little bit about yourself, brother.
Being originally from New Jersey, I should have known about the time difference. I totally forgot because we don't change our time here at all. So that was surprising to me nonetheless. Sorry about that. But I'm Brian Kovacs. I medically retired out of Arizona Department of Corrections. Worked at the Special Management Unit, which is a level 5.5 Supermax facility. That's where 99% of my experience happened, dealing with high-risk code red type transports for the worst of the worst, Mexican mafia leaders, that kind of thing. Typical, the most violent predators and things like that. I've been out and I've started several companies, and one of those companies is Talking Guns. TalkingGuns.net is our website, and become kind of a, for lack of a better term, an officer advocate for the correctional facilities here in Arizona. They need an advocate on the outside. Currently we have a reach of about 6 million people, so that's what I use my reach for. We also provide news and information and the Second Amendment type resources. So completely objective information too. We're not paid at all. We don't get funding from any of the, like magazines get advertisements and things like that. We don't play that game. We give you an honest, no BS review of products and equipment, especially in the corrections industry and stuff.
Well, I appreciate you, Brian. And by the way, Brian, obviously all you guys, definitely a people of your word. I needed a favor the other day from Brian, and he came through above and beyond, just like I am sure every one of you have for me so far. It's just Brian's been the most recent favor that I needed. And then now we have my favor today for you guys coming on. So I greatly appreciate that. And you guys keep being people of your word. So thank you, because it would suck if I do this show and then people decide not to come in, then I'm by myself. So, all right, guys. So we're going to go to our sponsor. But if you guys happen to show Tier Talks to you brave men and women that work in corrections, so please subscribe, interact, engage, comment, hit that bell. That bell's going to notify you every time I post a video. We're going to go to our sponsor. And then when we come back, we're going to give you guys some updates on COVID-19, the coronavirus, and also share some advice with some personal questions that have been sent our way. And we're going to kind of float some discussions on that. And all right, just stand by for our sponsor.
I wanted to attend a university that had an intelligence program. I wanted to look at problems different. I wanted to increase my critical thinking abilities. AMU offered those avenues to expand. Obtaining your degree as an adult, you're actually paying yourself and investing in yourself. You can't put a dollar on it, it's priceless. It's something that can never be taken away from you.
American Military University. Learn from the leader.
Guys, inmate manipulation is a course that is highly needed. It's the process that's so slow moving and subtle that you don't realize it's happening. When inmates choose to manipulate, they manipulate our need to react. Situational awareness and insight is going to save your career. It's going to save you from doing foolish things. Listen to your gut. So the more insight we have, the more we can recognize what isn't so overt, and we can correct our behavior before we fall into a trap that we can't get out of. If you allow an inmate to pull you out of your prescribed role, you are opening up a door for a host of problems. Inmate manipulation, the psychology behind inmate manipulation. Available now. Link in description. And we're back. All right, guys, I would like to dedicate this episode to two fallen officers that we've had due to COVID-19. The first officer comes out of Ohio. A Marion Correctional Institution officer has died from COVID-19. The first Ohio correctional officer to die of the disease. This comes from the Ohio Governor, Mike DeWine. John Dawson, 55, Mansfield, died Wednesday after he tested positive for COVID-19 on March 30th. The second MCI correctional officer to test positive for the virus. Mr. Dawson's death reminds us that as we celebrate the fact that Ohio is doing comparatively well, we're still seeing a large number of deaths. People are dying every single day, Governor DeWine says. Our heart goes out not only to Mr. Dawson's family, but to all those families who are suffering because they have lost a loved one because of this coronavirus. And I do have another officer that I would also like to dedicate it to. Palm Beach County deputy dies from complications of coronavirus. Sergeant Jose Diaz Ayala, 38, says he had underlying health issues, but the Palm Beach County Sheriff Office announced Saturday that a 38-year-old sergeant has died due to complications from the coronavirus. Sergeant Jose Diaz Ayala was battling under other underlying health issues before contracting COVID-19, says the spokeswoman for the Sheriff's Department. Diaz Ayala began his career with the department in 2006, working as a corrections deputy before being promoted to sergeant in 2016. His death was announced on the same day that Broward County Sheriff Gregory Toney said one of his deputies died after testing positive for COVID-19. Hey, guys, I just want to maybe ask a question. This will go to everybody. So we'll start with Lewis, then Piper, Connie, Darryl, and Brian. But we asked this question the other day, me and Connie. I just want to reiterate it. If people aren't taking this serious right now and they're just kind of not caring at all, what would you say to them? Go ahead, Lou.
Sorry about that. Kind of hard to take the on mute button, but we'll work with it. I don't understand, and I don't know who has not gotten the message across where you know that this is a serious and an epidemic. It's really hard to understand and comprehend. I mean, everyone knows about it. Everyone knows how we need to protect ourselves, especially in the facilities that we work in. I can give you an example of, I had to call PSE&G today, which is our electric and gas company. And they called me from the street and say, hey, listen, I'm coming out. I'm going to help you with your emergency, but I cannot come into your home. I can't have you interact with me. We're going to talk over the phone, and you can explain to me what's going on. If I have to, I will come in. But it's so imperative that we get the message across, especially to our correctional brothers and sisters. Listen, this is real. This is happening. We're in the midst of it. I've lost two good friends in the last week or so. Friends, lifetime friends, 27 years. And it's got to be reiterated every single day as we go to work to protect ourselves.
You know, I'm just going to jump in exactly and agree with Lewis that, the only people that I can think that don't understand what's going on or don't have a full grasp, they must be living in a cave somewhere, because it's obvious. It's on every news broadcast. It's in every magazine, newspaper. Of course, it's all over our phones, blowing up every article I read. Even the articles from ESPN are talking about COVID-19. So everybody knows about it. It's really just ignorance at this point, and people who've just decided that they're above reproach and they don't need to follow those rules. But the folks like you just mentioned, the ones that are essential workers, hats off, of course, to the medical personnel, because they're the ones doing the hard work every single day. But there are a lot of unsung heroes, like you said, the electrical workers that are out making sure we get gas and electric, and the garbage man and the folks working at Walmart. And, absolutely the folks behind the walls every day continuing to work like nothing's happened. They can't change a single thing. We're still a 24/7 industry. So if they don't know by now, unless it touches their direct family, I don't know what we can do, because these people are just indifferent to what's going on in our society.
Yeah, Connie.
Well, I mean, I think so. When we talked yesterday, we were at like a little under 1 million cases, and today the global case count is 1.5 million cases, and the total global deaths is 87,706. And so when people are saying that this is not real, they just need to look at the numbers. I mean, our reality is that even if it hasn't quite touched you, we know enough to know that this is something to be taken serious. I mean, so much so that we now have our Customs and Border Protection folks that are preventing critical supplies from being shipped out of the United States, because they want to make sure we have what we need here in the United States. So whatever rock you're under, you just need to come from under it, because the reality is that it's happening.
All right, Darryl, what do you got?
So I agree with everything you guys have said. I think the hard thing for everybody to fathom with this whole idea is that it's invisible. We don't see it. When people are sick, they don't really show signs of it. They can be ill for up to 2 weeks, spreading it around, and nobody really knows, other than maybe a little cough or something. So I think that's where some of the non-belief comes from. And that's why, like Anthony mentioned earlier, you got to go with general precautions. You've got to understand that potentially everyone is positive. And if you look at it from that aspect, that's the safest way to go with it.
I think that's great advice, Darryl. You're correct. Hey, Brian, what's your thoughts on that?
Well, one of the big things that I could tell you is there's a lot of officers here in Arizona specifically that have been looking for, masks and personal protective equipment, and they haven't been able to get them. In fact, our director actually denied officers in the institution from wearing any kind of protective equipment, which will only make the situation worse. However, they are still forced to work in the quarantine pods. They were refraining from testing inmates here, so they didn't have to admit that they had contagions in the institutions. However, we knew that they did, and they're just starting to come to the surface. We have multiple facilities here in the state that are currently, housing contaminated inmates or, infected inmates and treating them, basically as quarantines. But the officers still are lacking the necessary equipment. They have to provide it themselves. The state isn't offering it. My thoughts on that are everybody in every facet of what they're doing need to be aware of this, and they need to be protective of themselves and others around them. It's not just a yourself type thing. You need to be aware if you're going into some place and people aren't, exactly being cautious, then maybe that's not the place for you to be, especially if you have a weakened immune system or you're susceptible to illness anyway, So I think those are things that people don't always think about. They don't always think about, it's the other people's problem also. They should be aware of it too.
We kind of touched on these topics before. Thanks, Lou. But I want to reiterate some topics again, because in case this is the first time people are watching it, there's still some topics that I want to try to cover again, just to keep people informed. But one of the issues that we have are people that are still reacting. Like obviously when it happened up here in the East Coast, it was novel to us. So we're scrambling a little bit, but we're starting to make our way through and starting to discover what works and what doesn't work. But there are some states right now that it hasn't happened to them yet, or some facilities that it hasn't happened. And it's like things are still as normal as if it can't happen. And what me and Connie had discussed prior, I know me and Soto has, me and Russ has, is that at this point, everybody should be acting on universal precaution. Everybody should be screening those employees, keeping the facility extra clean, making sure we have enough protected equipment. Also, maybe stop transferring inmates from one hotspot to an area that's not a hotspot. But I'm going to start with Brian first and then work my way down the panel. So same thing, but how come you feel that a lot of facilities aren't willing to lock it down at this point? Why are we waiting so long to lock the facilities down? Brian, you go first.
I think it's the same problem that plagues everywhere is liability. People are going to complain when the inmates get restless or they complain about it, then lawsuits start. There's just a lot of legalities that I think they're afraid of, and they know they're going to encounter them no matter what. The other thing is that I think, much like everywhere, the shortage of staff nationwide is another problem. I mean, you may not have enough staff to implement everything being brought to the inmates, to the runs, to the cells, to support a complete lockdown. So I think it's on that end, that's another logistical part of it.
Hey, Darryl, let me ask you a question. Do you think at this point we should be locked down like the federal government, the FBI, the FBOP? You think we should be doing what they're doing and just lock the facilities down until we get a handle of this?
That's a tough call. You look at that aspect of it, and we're a 24/7 operation everywhere. So you can't really just stop everything. There's still courts going on. People are still getting sick from regular things going on. It's hard to put the brakes on an operation in any state or any county for any length of time. And that's a call each area's got to make on their own. So that's a tough call.
Well, Connie, let me ask you a question. Due to the threat, and you obviously being familiar with the medical side of it all, do you feel that, obviously because the threat is growing, especially in our regions here, do you think a limit of movement, a limit of people allowed into the facility, maybe keeping some consistent staffing and not, changing them? Like basically this is team A, this is what team A should be. And then obviously if team B is needed, then we'll get to them, but we'll try to keep people, consistent and maybe even quarantine that staffing, so they can't go home. They can't, just to kind of keep the, try to get the numbers leveled out. Do you think we should be at that point now where the facilities are locked down?
So I think we've gotten to that point. I think just because you have maybe one or two offenders pop up here that are positive, one or two over there, you don't know how long they've been sort of festering in these areas. You don't know who they've exposed, who've now been exposed to them. And so as you start moving them around, what it does is it creates these pockets of having, the virus in different areas. And when, to Brian's point about staffing, when you think of how much resources do we have to dedicate to go forth and treat in various areas, as opposed to having everyone who might possibly be positive in a particular area where you can kind of focus all of your efforts and your resources into that one area. I mean, I was looking at a report today where they were talking about for nurses in the hospitals, what they decided to do because so many first responders are coming back positive now is that they're setting up like these, almost like creating stations. So like, this is the intubation team. This is that team who does this specifically, so that they're not like constantly exposing the staff, those who are left who haven't been tested positive. I think there's just a better way for us to utilize resources so that we aren't stretched so thin and that there's not so much strain on the system itself.
I agree, Connie. And Piper, you being a warrior in the profession, and I use the warrior because that's what we are, Guardian RFID as well. The reason why I use the verbiage, but we are warriors. There's no, we know that. So I think that if we were to go in lockdown, right, and we were to keep things consistent, which I mean is okay, I'm sorry guys, but you know what this job's about. You're essential. We're going to need you to kind of camp out with us for a while. We're going to need to kind of quarantine you here, and don't worry, we'll take care of you. We'll pay you food, whatever the time you're here. If you are the 8 hours that you got to sleep, whatever it is. But we need to kind of utilize just that one team and then kind of hold team B as a backup. But don't get me wrong, there may be some level of self-quarantine there. Do you think our officers would step up and do that? You got the question, or?
Yeah, that's a really hard thing to do, to ask these individuals to give up their freedom, if you will. I was one of those guys that I'd work 12, 16s, whatever you needed me for. My family was very understanding, and they told me, hey, you go to work, you take care of it, you're doing a tough job. If you got to stay at the facility, stay. But you're asking people to not only stay there 8 hours, but now you're asking them to stay for a 12-hour shift, plus sleep there, live there. It's almost militaristic. yeah, we do need to go to more of an FBOP philosophy and a lockdown. Why? Because the more movement we have, the more exposure. Connie brought up a great point. You start transferring those pockets all over the place, and now you're going to expose more and more people. Lockdown is really our one true chance to stop this thing, to, I hate to use it, but flatten that curve. And unfortunately, we're going to get exposed. That's just a fact of being a warrior and being on the front line. And, Alabama has covered it. Augusta, Georgia's covered it. They're starting to give these guys commiserate pay, battle pay, to take care of it. I don't know where the counties and states are going to come up with the money, but they're going to have to come up with some money to pay these folks for this extra, this duty pay, if you will.
Yeah, I'm actually going to touch on that right after Lewis gives his response, because I have an article about what they're doing with the hazard pay. Hey, but Lou, I want to ask you kind of the same question. You being a warrior on the field as well, and you know what this threat has the potential of doing. Do you think it would be reasonable for us at this point to say, hey, we need a team A and we need a team B, and if you're team A, this is what's expected of you, and you can obviously keep in contact with your family, but we need you to kind of commit yourself here until we're able to level this out?
So you know what? We've done that here in New Jersey many, many times, whether it be a torrential storm or snow falls to the point where we can't get out. We've had those instances happen in Jersey, and we've seen it work. So I'm going to tell you something that somebody said. It's so simple. The virus doesn't move. People move. If the people stop moving, the virus will die. Let's stop moving. If we lock down our jails for 14 days, you'll be able to squash half of the stuff, if not more. I'm telling you, I spent the last 2 weeks at a different facility from the one that I work at, because the director became infected and he had to quarantine at home. So I've been there for 14 days. The first thing I went in there and did was protect the staff by having them wear the mask, gloves, cleaning, and I locked down the place. Meaning no visits, no more intakes, no more anything of movement that doesn't need to happen. The virus will stop. I had 12 positive, 30 people in cohort, and now 2 weeks later, I'm down to 1 positive and no cohorts. That's just reality. This is how you have to attack it. So again, let's lock it down. Give me 14 days, guys. Give me 14 days and we can make a difference.
Hey, Connie, before we go into the first update, I want to ask you about what Lewis said. I actually like that, where he says the virus doesn't move, but people do. What's your thoughts on that from a medical perspective?
That's absolutely true. I mean, disease transmission is just that. Like, you can't beat the science. If there is no host available to transfer to, there's nothing to be done with that. So if in fact you do quarantine, anyone who's tested positive, you provide them with whatever level of treatment or stabilization you can, you've now isolated your event. And so the fact that you still have facilities that are still transferring inmates around and that are still doing programs as usual. I mean, I just read about, I think it's Parnell Correctional Facility near Jackson in Michigan. As of Saturday, they were still not screening employees coming out in and out. They were still not testing. They still had inmates kind of hiding their symptoms because they still had the co-pays going on. They still had ongoing classes and they still had programming. And now they've got more cases inside than there is in the county outside of the wall. And so how do we do that? How do we justify that when there's enough evidence out there that says, here's the things that have been working. Here are the best practices that we know are in place, that they're working in other systems, but we've still not responded to protect our people or the population.
Yeah, and I figure at this point that's actually unacceptable, only because what's happening elsewhere and you're not actually learning from the scramble that we're going through. So I mean, we're here scrambling to find a path, and you should be looking what's happening. But the one thing we could always get back and say is, don't wait for it to come to you. Be preventive. Get those scannings in. Get those PPEs. Do whatever you can. But we were forced to react. These other places that aren't affected yet, they're not. They can get ahead of it. Now, Piper talked about hazard pay. So what I'm going to do, guys, is I'm going to read you a bit of an article. It's going to tell you some of the compensations that are being offered, and I would love your thoughts on which ones you think are the best. And I'm going to read a few off because they're coming from some different states, but basically, last month, U.S. Treasury Secretary Steve Mnuchin said hazard pay for first responders could be considered for future legislation to address the COVID-19 national emergency. As federal officials continue working to implement the third COVID-19 stimulus package, several local governments have already passed their own legislation to provide hazard pay and stipends for first responders and other frontline workers. Below is a list of municipalities, counties, and other local governments that have implemented hazard pay, stipends, or other benefits for frontline workers during the COVID-19 crisis. This list will be continually updated as new information becomes available. So let me just read a few states. So we got Alabama. So Birmingham, the Birmingham City Council approved a 5% hazard pay raise for about 2,000 city employees, including those in fire and rescue, police, and corrections. Also in Alabama, Baldwin County, the Baldwin County Commission approved the request from the Baldwin County Sheriff's Office to provide hazard pay for deputies, correction officers, and communication officers. Across the department, 279 employees will receive an additional $240,000 total per pay period. The precise amount to be received by each employee was not reported. In Georgia, which is, me and Piper were talking about this earlier today, Atlanta Mayor Keisha Lance Bottoms issued an executive order providing $500 a month in hazard pay for public safety, sanitation, and other frontline workers during this pandemic. Augusta, Georgia, the city of Augusta has implemented an additional $5 per hour in hazard pay for about 1,400 essential critical infrastructure employees, including firefighters, law enforcement, EMS dispatchers, and sanitation workers. Go a little further. Let's go to Kansas. Sedgwick County Commissioners has approved hazard pay of $200 per month for county employees, including first responders. The provision will last for at least 2 pay periods and can be extended by a later vote. Let's do Texas. Donna, Texas, the Donna City Council unanimously approved an additional $700 per month in hazard pay for 29 patrol officers, 3 firefighters. In the city, the provision is currently set to last for 6 weeks, but could be extended, officials said. So I'm going to start with Soto first. Hey, Soto, you've been in the business of corrections for so long. How good is it to know right now that you actually see corrections involved in this? Like they're actually saying that corrections deserves the hazard pay.
You know, it's absolutely necessary. That's what I say, because we take on this job. We know what can happen. And whenever an epidemic like this happens, something that we really didn't even think about. I mean, back in Jersey a couple of years ago, we weren't even thinking about earthquakes. We didn't have policies in place to deal with an earthquake. And guess what? An earthquake hit. And our officers, they didn't run away. We still have to run our business, right? I call it a business, but it's our job. It's our profession. And why not take these individuals who are putting their life at risk, and not only their life, but remember, they go to work, they have to clock out and go home. Now they're bringing that risk sometimes to their homes. You should see me coming home from work right now. I have like almost a hazmat station at my front door where I go directly to like decontaminate to come inside. So you have to understand that these men and women are going to work. They are risking their lives. Kudos again to the medical department, the fire department. Everybody is putting their lives at risk, right? And we know that the reason for it is the only way we're going to get through this, by all working together. So why not give them that nice essential pay for the hazard pay? I would, if I had it in my pocket, I'd give it to them myself. But you know what? At the end of it all, we will have to find these extra dollars, funding, and make sure that we take care of our people.
Right, I agree. You know, I've done this show for so many years because I believe that corrections is forgotten, and I believe this is a great chance for us to be seen as equals. I remember, I think I was on Al Sharpton, I forget, MSNBC, and he was talking about the Blue Lives Matter laws, and what they didn't realize is we didn't know if correction was involved in that, because some states like New Jersey were law enforcement and we would be put into that, but other states they're not. And, you know, now it's good to see that. Even though I still don't like the separation, I'll be honest, I still don't like saying, yeah, we're going to cover law enforcement and corrections. I would like to see corrections automatically put into that law enforcement. But with that said, at least we're not forgotten. Now, Piper, during what we're going through now, you need motivation. So do you think hazard pay, I mean, besides showing respect and recognition to corrections, do you think it would motivate people to step up and do what needs to be done?
Well, if money is the reason that you got into corrections, then you got in the wrong industry. We all know that. We didn't get in it for the money. But I just have 3 words when it comes to hazard pay. It's about time. I know that a month ago, I have friends of mine who work at the coffee capital, right? Who work at Starbucks. They got $3 an hour raise for working during this pandemic. If Starbucks is going to give $3 an hour, we sure should be able to give our corrections officers $3 to $5 more per hour to work in the same thing. But why do we have to wait for this? I agree. This has just been it's unprecedented, obviously. I mean, it's unheard of. But is money the motivator? No, that's not what we do. But it's nice because you can't put thanks in the banks. So, yeah, it's nice to give the people something because we really don't have any other things we can give them other than a pat in the back and a promotion.
Yeah, you're 100% correct. And you know what's funny is I love the fact that you brought that Starbucks thing up because I didn't know about that. So that's good to know.
Yeah, my daughter works at Starbucks and, she took it, obviously, but they're also offering those same employees the opportunity to take 30 days paid off if they felt like they were in an unsafe store. So if one of their partners, as they call them, felt like they were unsafe or they were going to get sick, they could take 30 days off. Yeah. Now, I wish all the brothers and sisters out there in the thin gray line could take 30 days off if they felt unsafe, but we'd have nobody left inside the walls.
Yeah, and I'm going to touch on that when we're done with these rounds of questions. I want to actually touch on leave because still some facilities are still making officers go in or go home on their own time, which most states have stepped up because you want to motivate the employee to do the right thing. If I'm not feeling good, do the right thing as opposed to, well, now I got to worry if I'm not going to get paid or not. Hey, Connie, how does hazard pay motivate the medical profession?
I mean, there's not really much motivation there because the reality is that there are mandatory staffing minimums. And so from a medical perspective, if you don't come in, someone's going to be hit with mandatory overtime anyway. And so they're getting this extra compensation, but the reality is that most medical professionals don't want to go home knowing that they've got sick patients, right? They don't want to go home knowing that this person needed this thing or that person needed that. There's some treatment that needed to be provided and they weren't there to provide it. And then they come into work on Monday and that person has transitioned, right? Like those are just not good experiences from a medical perspective that you want to have to deal with, knowing that if I just came in or if I just stayed that extra 30 minutes or if I just stayed the extra shift, that person could have probably gotten their treatment and survived to see another day.
Yeah, and obviously I agree with you, Connie. Hey, to my 2 frontline advocates, Darryl Smith and Brian, if someone was to question the need for COs to get hazard pay, how would you respond to that? Darryl, can you go first and Brian right after?
Yeah, hazard pay is like Piper said, one of those things that it's good to have, and when you get it, you're thankful. But you don't go into this job looking for the pay. So when it's given, it's appreciated. We're in close proximity inside the facilities, just like a lot of these senior citizen homes. Once it gets into that facility, it's going to spread like wildfire, and mostly because you can't see it, and a lot of people are in close proximity to each other. So. Hazard pay is definitely something that's got to. I hope a lot of people recognize that it's something that needs to be given to our people, our frontline staff.
I definitely do think that the hazard pay is a good way to reward the officers who are out there, who are, putting their lives on the line and also putting their families' lives on the line, because every time they come home, they could easily spread whatever they may have contracted to their families, to their friends, to anybody they interact with. So I think that it's an inherent danger of the job that they end up, getting something for that, some sort of compensation. But I'm of the same thought. We didn't get into this for the money. We didn't get into this for the reward of it. We got into it because we like the job itself, the people that we work with, the concept of what it is, and the rule of law, right? So I think that states should step it up. They should follow suit like these other ones that you mentioned today, Anthony, and it's get on some sort of program like that and push the limits and try to get officers, not just corrections officers, but police officers, firemen, EMS, they're all out there dealing with the same exact thing, whether it's inside or out.
Yeah, and what I like right now is just the fact that they got corrections involved in the hazard pay. It's kind of when I brought the question over to Lewis's attention, was the fact that at least it finally gives us the recognition. You're right. It's not so much about the money, because you wouldn't be in this profession for the money. But it does show a level of recognition that someone's stepping up and saying, hey, yo, don't forget about these people. They're frontline warriors, and, let's start, giving them the respect that they deserve. So just the fact that they're including corrections. Now, guys, I'm going to take a break from the updates for a second, and I want to read a personal question that was sent our way that I said I would forward to the panel. So what I'm going to do is I'm going to ask the question. I'm going to give it over to Connie first, and if you guys feel that you want to add something to it, just show me your hand, and then we'll just go straight down the line. But I wanted Connie to attack this question first, and then maybe we can have a little bit of a dialogue, because I told him that once we answered this question, I'm going to send him a link to the video, and then he's going to show it to his people. So here's the question, or here's the question or situation for you. And due to my wife still being an active CO and the fact that I have a pending application with my local county jail, I would appreciate being anonymous so we don't face retaliation. When escorting an inmate, COs are not told of any medical condition so as not to violate HIPAA. Given this pandemic situation, shouldn't suspicion of COVID-19 bypass HIPAA for the safety of everyone else? My wife was told to escort an elderly inmate to the medical building, a routine event at this specific facility, without being given any PPE or notice that the inmate is sick and under investigation for COVID-19. She only found out about this because the inmate told her after they arrived at the medical building. My wife came home in tears and is afraid to breastfeed our daughter because she's scared she's at risk of carrying the virus. Connie, what's your thoughts on that?
I did not want to answer this one.
You knew that was coming to you, though, Connie.
I knew you were coming for me. All right, so the real answer is yes. Medical is not allowed to provide that type of information to custody. So the warden typically is authorized to have access to any information, or his designee. And so what we've had to do is, in the past, if there was someone who was high risk, we were able to communicate that information to the warden, and then the warden would then communicate that information to his empowered delegate to ensure that everyone was safe. I think at the end of the day, we know that right now, so universal precautions are just that, they should always be taken. But the issue here, it sounds like she wasn't even given any protective equipment to begin with. And so now she's transporting a high-risk person without any protection for herself, which I think is negligent on the part of that department. So reality is that she does have valid reason for feeling afraid, right? Because she's now been exposed. I mean, it doesn't go into whether or not the person was symptomatic and were they coughing or whatever, or even was that person in any way protected while she was transporting. So those details, I think, could kind of shift the way we look at things. But I think our reality is that the universal precautions weren't followed. She wasn't provided with the protection that she needed so that she could follow universal precautions. And on top of that, after finding out this situation, who knows how long it would take for her to even gain access to a test to know whether or not she's been exposed and possibly positive. So her concerns are definitely valid, and, shame on them for not protecting her.
Right. There's the negligence aspect. Would anybody else like to comment on that?
If I could add real quick to what Connie was saying, I think that it's the prison system's job to notify the officers, hey, these are potential or these are definitely, infected inmates, because then maybe they'll get extra resources, even if they have to bring them in on their own, if they know that they're working around people that are positively infected, not just possibly infected. A lot of officers right now, here at least, not being given PPE for this, occurrence, are making stuff at home, in simple masks and things like that. But the reality of that is it doesn't actually protect you against anything. It's not going to protect you from transmitting to them, and it's not going to protect their transmission to you at all. It's unfortunately it's just not something that's effective because it doesn't have the filtration or, the spec to do that. So I think that if they get into the program of, even if they don't say, hey, this inmate or whatever, maybe just this area, or maybe they just take anybody, that is symptomatic or is positive and round them up instead of keeping them, most of these people are still in a general population setting. So, I mean, it's just going to continue to get worse.
Well, Connie, real quick, one last question. So a lot of facilities, you're right, they got to start quarantining these inmates. They got to start isolating these inmates. But obviously the officers that work in those quarantine areas, they're pretty much aware of what these inmates could possibly have, right? So, I mean, that there is not a HIPAA violation, obviously, correct?
No, I don't believe it's a HIPAA violation. I mean, I think our reality is that the better relationships that medical and custody have with each other, the better those lines of communication could be established. And it makes it much easier for you to even just say, you might want to make sure that you have your mask and your gloves for this transport. Like, that's not necessarily you saying this person is positive, potentially positive. It's just saying, make sure you're protected without necessarily violating that person's HIPAA rights.
Yeah, Soto, let me ask you something, because you've been in training for many years. You teach universal precaution regardless. So, I mean, every inmate has the potential to have something, correct?
That's absolutely correct. Anytime the medical department, and I've done this for over 27 years now, the medical department has always used a specific term, which is universal precautions, right? I mean, no other time in my department, in my time in the department, has that class that we get every year, right? Blood-borne pathogens been so important, right? I bet you'll have a full class next time you give that class, and people, yeah, I heard that before, but I want to pay attention, and I have a question, right? Because it's the truth. Universal precautions, it's what is necessary. You're going to wear at least the minimum when you see that written on any paperwork or is given to you verbally or whatever. But shame on that department for allowing their staff not to be protected. That is just, it's unreasonable. I don't know why they would do that. You're putting not just the inmate population at risk, you're putting your staff at risk. At the end of the day, you're going to run yourself without staff in a minute. Everybody's getting infected, and now you're not even going to have the staff you need to run your place. It's just, I'm at a loss for words after I read that question today. It's just ridiculous.
Would anybody else like to comment before we go to the next update?
Well, I did want to say that we could probably do an entire show with Connie at the head talking about HIPAA when it comes to corrections. Because between state facilities, county facilities, that comment you made about the warden or his designee, that leaves a wide open, because who's your designee? Well, I'm the night shift supervisor, I'm the designee. Well, I'm the pod officer, I'm the designee. Because, people get confused what HIPAA really covers. They think it's the information. No, it's the Health Insurance Portability Accountability Act. So it has to do with more insurance than it does anything else, but it also has to do with, you can't walk up and say, this guy's got this 3-letter disease or this disease. But universal precautions, I'm just floored that the officer didn't take it upon themselves to say, whoa, I'm not going to transport this person unless I take care of myself. But if the facility's not taking care of their people, that's a huge red flag in my book. And I know that Darryl would absolutely agree that if facilities aren't taking care of their people, we have much bigger fish to fry.
What do you got, Darryl?
Yeah, I agree with Piper. That's something for sure that brings into question the management, their decision. Of course, we don't know what the timeline was on this. We don't know if it was 2 months ago or last week or even this week. And we've seen the progression and the timeline of how these decisions have been made. Back in early March, nobody was really putting too much serious thought into a lot of these situations, where now it's in your face. So, yeah.
I agree with you, Darryl. And that was good point about the timeline. Hey, Connie, I noticed for a second you had your mic on mute. Is there a response you had?
No, I didn't have anything else to add.
Okay, I just wanted to
I was just very much in agreement with what they were saying.
Yeah, Greg is very energetic. Go ahead, Lou. I saw you lift up your hands.
And the reason I lift up my hand is, you know what? It's correct that a few months ago, yeah, people weren't taking it seriously. But I'm going to go a step further. And again, this is a panel of professionals, right? So if we disagree amongst ourselves, there's a reason for it. Or if I say a comment and you have something to say about it, say it so that we can have this dialogue. And what I'm saying is that a few months ago, not only were we not taking it seriously, or management wasn't taking it seriously, I'll go the opposite. Management knew what it was, and it was trying basically to downplay it to the point where, oh, you don't want the officers wearing a mask because it's going to cause panic into the inmate population. So I'm one that I don't hold my tongue for anyone. I'm telling you, a lot of places were like, no, I don't need you to wear a mask. What are you talking about? I mean, have you not listened to the news? No. I'm telling you, some places were doing it on purpose, and they were using reasons such as that. Let's not cause chaos. Let's not cause panic. And in the meantime, what are we doing? Exposing ourselves to more and more of this epidemic.
You're 100% correct, because that was one of the concerns you could read about, where they felt that if you automatically put the PPE gear on, the personal protective gear on the officers, how the inmates would interpret that. And then if you had limited resources, you should put it on the staff coming in, because they're the ones that pose the threat. So now, you know what's funny, as we've evolved, and now hopefully we do get more supplies. At one point, when we were limited resources and we had to be strategic in how it was employed, of course, you want to give it to the outside coming in. But now it's gotten to the point where if we do have enough and you can manufacture, like in Tennessee, they're manufacturing it, within the facilities, then yes, I do believe at this point, if you could provide it to the inmate population, I'm sure custody could balance the safety and security concerns. At this point, I don't think we have a choice. But does anybody want to comment on what Soto said about the mask? Because I have anybody? All right, so I see Darryl Smith putting on a mask in a room by himself. You guys do want to comment on that. Okay, so go ahead, Bri.
I can just tell you real quick that it wasn't until Friday of last week that Arizona was actually allowed to wear masks in the pods and on the yards. So they were actually prohibiting officers from doing that. And they were using the justification of the CDC guidelines did not consider that effective or necessary. That was only for medical personnel. That's literally what they went to. I could send you guys the document that they put out. It's embarrassing, to be honest.
Well, it's great right now, because I'm going to tell you something, for the agencies that got hit with it first and they were scrambling, and now finally we're at that point. I hope the facilities that are starting to get it now, or maybe in the process of getting it, they don't fall for that. They actually do what they're supposed to do and get those masks on. Greg, you raised your hand for a second too? No? Okay, hey, one more question. I know we got another update, but I do have one more question. Someone sent me a question about having inmates work details that may expose them to the coronavirus, like, working in hospitals, infirmaries, quarantine areas, and either being able to force the inmates to do it or not. So basically, if you give the inmate the right proper protective equipment, do you think we're able to force the inmates? Or if the inmates say, hey, I don't want to do it, we shouldn't let them do it because of the liability. So what I'll do is I'm going to go first with Soto, and then I think everybody here may want to respond to that. So Soto, would you go first? What's your thoughts on that?
It's another hard question, and not only because you may have personal feelings about things, but also because in corrections, we rely so much on the inmate population helping out in different areas, including hospitals and, you know, when we need people cleaning up. In the private sector where I'm working now, you know, we use the residents, right, the inmates, to help us clean certain areas where we were using as isolation cells as soon as they were vacated, as soon as they were empty, right? And I think that over time, we kind of rethought our way of doing things, and now we're getting an outside agency to come in and do the cleanup for us. So it's all a matter of, it's a fluid time and place. So that what do? You learn from what you go on. So, you know, I started off thinking one way, but as I'm actually in it, I'm thinking a different way. You know what I mean? Should we have the residents there? Well, we're exposing them to more and more. And what is that going to do? Is it going to contain it, or is it going to spread it? So that's how you got to think about this one. I'd like to hear from the panel what other thoughts are out there.
First of all, I want to comment too, and then we'll go to Greg. You know, from the administrative level, I'm always thinking of liability, right? So let's just say I have an inmate that just is uncomfortable doing it, and he puts it on record somewhere, let's say through JPay, written, whatever it is, that he doesn't feel right doing this. He has underlying medical conditions, whatever it is, and all of a sudden he gets exposed and something happens to him. There's a real big liability there, because it's going to have that I forced that person into the job. I still think I can find inmates that would be able to volunteer, but I may not want to force that inmate into that job because of the liability. I don't know if the frontline officers may see that, but I know from the administrative level, that's something I would definitely see. And what I would do is definitely remove that inmate. But I think the wake-up call for me would be, if I didn't have access to like an outside vendor, I would probably go ahead and say, you know what, let's look for volunteers first. Make sure somehow we documented that they volunteer, because sometimes you may have inmates that will volunteer and then write something up a little different on, you know, maybe a JPay or something. But I would ask for volunteers just in case, God forbid, something happens to one of those cleaners. I could say, well, wait a second. We didn't force them to work. And the second thing is, we also gave them all the personal protective equipment that was needed to do those jobs. Hey, Greg, what's your thought on this?
You took my answer completely. That's exactly the way I would do it. It's not a lot different from when we had, I guess you'd call them porters or pod workers or whatever, inmate workers in the prison system. You know, when you had a guy who cut himself or in the shower, you know, committed suicide, you'd find the guy who would volunteer to go in and clean that cell because you were dealing with blood or feces or what have you. You know, you'd find the inmate who would volunteer to do it. So in this case, yeah, we have to have volunteers. California, maybe even in Arizona where Brian is, they had hundreds of inmates putting out forest fires, and they paid them. So yeah, we find a way to reward them for volunteering, for doing that. But I know there are inmates out there who would absolutely volunteer to do this job. They volunteer to take care of the sick and the elderly. They volunteer to do all sorts of things. Yeah, there are guys out there. There are good human beings. Remember, these inmates are human beings who would be willing to do this. And as long as we don't force them, great point, make sure we get something from them. We don't force them. They volunteer to do it. Then by all means, they want to participate. They want to be on the front lines as well.
Right. And Connie, how would that help out medical if inmates were volunteering to do these types of cleanings?
I mean, it's great to have extra hands doing that kind of cleaning. I mean, when I raised my hand just now, it really was just to offer the other side of that, because I think, like, we're very optimistic in the thought that people making the decisions would be objective and not feel like they needed to force people or force any of the inmates to do the cleaning. I would like to just offer that if you do force them to do the cleaning, you got to be almost standing right over them to make sure they're actually doing it the right way, or that they've actually done it. And so when you mention liability, you think of if you force someone to go do the cleaning who doesn't want to do the cleaning and they don't do it properly, then it leaves so many people open to somehow getting sick from this room or this area that hasn't been cleaned properly. So that's just kind of what I wanted to offer to the discussion.
Yeah, I remember we touched on that a little bit the other day, where if you do have inmates that don't want to do it, they may fail to do it the right way. And now it becomes a bigger problem because now it's going to spread. Hey, Darryl, what's your thoughts about that, about either forcing the inmates to do the job or not?
I think Soto and Piper both covered it pretty good. You're always going to get some volunteers. Like they said, there's a little bit of premium pay sometimes involved for them. And the issue is contamination. If they don't do it properly or they get exposed themselves, and then they take it back to the housing unit, and now it's out. It's everywhere. So that's really the concern.
Actually,
I always think you're going to find some volunteers.
And you know what's great? That's actually one of the things that Lewis mentioned, which is good about having the contract vendor, because there's no chance that, the inmate's going to bring it back to the unit. So that's, a great point that you made, Darryl. I appreciate that. Maybe someone will pick up on that. If they, have some money and they can actually, hire a vendor, that would be a great reason to do it instead of having the population, because the risk that they could bring it back into the unit. Okay, go ahead, Soto. I see you raising your hand.
Yeah, and being that I work in the private sector, they kind of tell us every day, make sure you put down everything that you are doing that is COVID related, right? So us on the public sector, we need to do that as well, because you can always, at the end of it all, there's always funding. So even if you have an outside vendor coming in the public sector to clean up, to do things, just like we do in storms, right? And FEMA gave us all that money because we used some things to repair, to fix, because it was necessary. So keep track of what you're spending every single day that is COVID related. Doesn't matter what it is. Even the overtime, where you have the nurses doing so many shifts, you got the correction officers doing so many doubles. You have to track that stuff so that you later on you can put in for that aid that they will be offering.
And that's great advice, because I don't know if a lot of agencies are doing it, but again, if they do get affected, they should jump at that right from the middle. Keep track of that minute by minute. Hey, Brian, what's your thoughts on that with the inmate labor?
I think the inmate labor is something that they would be able to grasp, and it'd be pretty easy to teach them, hey, this is what you need to do and manage those inmates to do that. The problem is, again, comes back to resources, right? How many officers are currently out? How many do we have available to sit there and supervise, like Connie said? Because they're not always going to do it properly or completely to the spec that we say. However, it is something that could augment a lot of resources.
Well said, Bri. I agree with you 100%. I'm going to have two more updates and one more personal question, then I guess we can start wrapping it down. The first update, I think, is a very important update. Now, Rikers was one of the first facilities to be affected. Their numbers are crazy high, but they're at that point now where people that were testing positive may have a chance of being ordered to come back to work. So I want to read briefly a little bit about this article, and then what I thought we could do is I would like to go to Connie first, then Brian, Darryl, and then work my way to Lewis and Greg. So real quick, 10 Riker Island correctional officers refused to return to their post early Wednesday morning for what would be a 24-hour shifts at a jail with nearly 200 inmates who have coronavirus, while 2 others with confirmed cases were told to return to work. A total of 18 officers redeployed from Anna M. Cross Center to Eric M. Taylor Center, a facility that reopened last month to handle the influx of COVID-19 cases, worked triple tours without meals or protective masks, according to several emails sent by Corrections Department staffers. Nearby at North Infirmary Command, a Rikers facility where people in custody receive medical care, 2 officers with confirmed cases of coronavirus told the news they were ordered to go back to work against the recommendations of their personal doctor. The new developments come a day after the news reported that at least 6 correctional officers, 1 captain, and 2 non-uniformed members of service have died due to coronavirus. As of Wednesday morning, 441 correction department staffers and 287 people in custody had tested positive for COVID-19. This is where me and Connie get confused, because some of these articles make it look like it's Rikers with that total testing, that number, and then sometimes they say it's the state of New York. This here, to me, again, it seems like they're saying that's the number at Rikers. But let me just finish the article, and then I'll go to Connie first. Just want to read a little bit more. Correctional Officer Benevolent Association President Elias Husamadeen said the new developments are another indication that the overwhelmed agency has not done enough to protect its personnel. Officers assigned to EMTC, which was open to exclusively house all COVID-19 positive inmates are being forced to work triple tours, often missing meals and coming in on their personal days. Officers who have tested positive, who are out sick, and who still display symptoms are being told by the Health Management Division at DOC that they should come back to work even as their personal doctors have told them otherwise. The truth is the department has clearly shown that the well-being of our members is their least concern, Hussamuddin said, knowing that the union is sending a letter to the head of the division threatening legal action. Hey, Connie, real quick, Rikers Island obviously has multiple facilities, correct? Can you explain the layout a little bit? Because you worked there for like 10 years.
Sure. So Rikers Island, once you get to the island itself, you drive across the bridge, the infamous bridge that everyone talks about. And then there's a security point there at which there's either you have clearance to drive to your facility or you wait for a route bus that takes you to the facility that you would work at. So these multiple facilities are spread out on the island, housing different levels, different ages. You got the women, you've got West facility. So you've got a medical space, you got one that's focused on mental health and one that's focused on the sentence population. So it's kind of just one big island with multiple facilities on that island.
Right now, Connie, let me ask you a question about what we have going on here with people being forced to come back to work after they just tested positive for the coronavirus. So I'm assuming, I mean, I know there's still studies going on where they don't know, like, you know, when you're no longer symptomatic, if you're able to come back to work, right? Because they really haven't determined if you're still contagious, correct?
Exactly. So a lot of things that are happening, I mean, I've been looking at all these studies and everything is yielding something different, right? So you've got one group that's pretty much saying, just because you've tested positive, like, so say you had already had the virus and it's gone through your system and you think that you're better, that doesn't mean that you're not going to have those signs and symptoms again, or that you won't be positive again. And they were looking at some of the folks from China who were in recovery, who initially they tested negative, but then they tested positive again. And so now it's kind of like, it's still just so unknown. I just couldn't imagine that the organization or any institution would be superseding someone's medical note. You know, I just think of the liability associated with you saying, well, your doctor is wrong, you can come to work anyway, because then you are putting how many other people at risk if you now have this person coming in against medical advice.
Right, and obviously Elias Hussamuddin is really leading the way. I mean, I know people think it's more of a local thing at Rikers, but because Rikers is one of the first facilities that's affected, he's pioneering a lot because we're learning a lot from what's happening there at Rikers and some of the stuff that they're going through, because obviously it could happen to us. Kind of shows you how consistent we really could be based on, you know, whatever happens in Rikers could obviously easily happen to us tomorrow. Hey, Brian, I know this is kind of in your wheelhouse. You have a union rep that's defending his officers, really going above and beyond. I'm a big fan of Elias to begin with. You know, he's been getting, the union's been getting the PPE equipment. He's been making sure they get paid for their leave. And now this. You know, what would be your thoughts on, you know, what the department is doing to these officers?
So my question would be is if those officers end up being forced to work, even though they are sick and have tested positive, and something does happen to them, let's say they end up in an intensive care unit or anything like that, who is ultimately liable for that? Is it the supervising officer? Is it the department as a whole? Who is the one telling them that they have to return to work against their doctor's orders? And does that give them implication to be able to sue because of that? Like, is that going too far? That's what I would like to know, is what is their take on that?
Well, hey, Connie, let me ask you a question before we get to Darryl. Can the department's doctor, because some departments do have a doctor that, I don't know, can they overwrite a personal doctor of someone? I mean, it's hard for me to explain, but I think Soto knows exactly what I'm trying to ask, right, Soto? Can you ask the question better, because I'm having trouble explaining it?
Well, just like we're saying that this is always going to end up involving HR, human resources, at whatever department you're in, and they're always going to say, okay, you went out for an illness, whether it's work-related or not work-related, doesn't matter. You're still dealing with HR. They're going to ask for doctor's notes, and there are state doctors that are looking at this. And again, we're a facility that has to work with the people that we have. We don't want to put them in harm's way, but we know that there's always that bad seed that is going to try to take advantage. So that's why the state doctors or the department doctors get involved in saying, no, we're going by what the CDC is requiring, that once you test positive and you've done the quarantine of the 14 days and you've shown 3 days of not having a fever and 7 days of not having symptoms, you should be clear enough to come back to work. Again, Connie, it's right. It's something that we're learning as we're going along, but right now that's what they're going by. So if the doctor at the state level or the department level is saying, hey, we're going with the CDC guidelines that we know at this point, are we going to be held liable if we're telling the officer you need to come or return to work, because we're no longer going to, take notice of you're on some sort of medical leave at this point?
So I think for me, there's no reason why I think the department cannot do their due diligence, right? So if an employee comes in with their medical note and there's some question as to whether or not this person still has signs or symptoms, I've experienced employees being told to go to our sort of objective medical person, right? Whoever that is within your state, to have like an independent medical exam, essentially. Now, it's not to say that, the employee has to do it, but if it's contingent upon you keeping your employment, like if I'm expecting you to come back to work, you don't come back to work, I tell you, here's our middle ground, which is that we're going to need you to submit to an exam with this independent medical examiner. Whatever that determination is the direction that we'll go if we're questioning whether or not this doctor's note is valid or whether or not this person is still experiencing signs and symptoms. I mean, because that takes away the liability from the department, because now it's not a supervisor that said, just come back. It's not like, someone arbitrarily telling you to come back and go against medical advice. But I think the bigger issue comes that if you do come back and then you start getting people sick, the employee now can say, I have my note that told me not to come back to work. Now look at what's happened. And I think that's just a bad position for us to be in, or for the institution to be in.
Well, you know what, if Darryl, if you don't mind continuing on this, I mean, you're very big with the front line. How would you feel if the state doctor went against the personal doctor of the employee?
Yeah, I don't know how that could happen. I mean, the personal note you got shows that you're positive, you're not fully recovered from the symptoms. We've seen in the news, where there's some cases where, it takes 2 weeks for the whole time period. But then after, for some people that are quick to recover in the milder cases, then you have some people that have more severe cases where that takes 3 to 6 weeks. And even towards the tail end of that, they're still passing that off to other individuals. I don't see how that can happen. I think Connie covered it pretty well. You're opening yourselves up there for a lot of liability issues that there's other ways to get around that, I guess.
Right, and Greg, Greg, I know you would like to, and then we'll get back to Brian. But Greg, you have a comment you want to say on this?
Well, I'm going to play devil's advocate for just a minute because, like Lou said earlier, we're professionals. We want to have an open dialogue. I'm not going to say that I don't think the officers have every right to say, hey, I'm not coming back to work until I'm healed, until I'm fully cured. But this is the one time we've heard of this. It's 2 officers. And we haven't heard yet from the department. We haven't heard their response. Maybe there's some underlying issue here. Maybe the doctor was Dr. Bobby, who is he's in a strip mall in Schenectady. How good is their doctor's note, right? Yeah, thanks, Lou. You appreciate that laugh. We don't know anything yet. So until we hear from the department what their side of this is, maybe we should pull the reins back. If this turns out to be a real issue, or the department is saying, no, you're going back to work, then by all means, we have an issue. But this is 2 officers, so maybe this is just a one-off. Maybe there's something more here that we're not reading into.
No, you're 100% correct, because obviously on the administrative level, also I'm sure, Soto, you were also a captain, so you obviously have that perspective as well. There could be people that may abuse it. Obviously we are aware of that, but my concern is I don't think there's enough study, and this is the scary part, guys, if once you have the coronavirus, can you still affect somebody? So I don't know if I would be in such a rush to get them back yet. I would just be nervous about that until someone says, okay, they're able to come back. I don't see any end result to that just yet. So I'm a little nervous, but I do agree with you on the one thing where you do have people who may manipulate the system just to get that time off. But I would like to think that the department does put a lot of things in check. So in order for you to do it, you need the proper documentation. But again, my greater concern would be is, okay, so they're saying they don't have it, but not enough studies yet can tell me if they're not still contagious. I don't know. Now I know, Brian, you raised your hands, correct?
Yeah, my only question was, let's just use a hypothetical here, and let's say the department says, no, you have to come back, and these people are infected and they're still infected, and they pass that on to other officers who end up, let's just say, critical, or let's say they pass it on to inmates that then sue the agency. At what point does this become an issue with the occupational health unit and, whatever your supervisor, whether it be a warden, a deputy warden, captain, whoever is making that decision that you have to come back? Where does the ball stop? Where are we at with that? Like, who is the stopgap to ensure that not only the officers are safe, but, the inmates need to also be assured that they're as safe as can be too, right?
Well, I know for a fact that from my perspective, I would not make that decision for the person to come back. I would definitely look to push that up to someone who, now don't get me wrong, if they're telling me, hey, this person has to come back, I'll be the person that relays the message, but I'm not going to be the person that's demanding that. I'll just be the messenger. But Connie, if that was the case, who would be the person that would tell administration that this person has to come back?
I mean, so whatever the final decision is, I'm sure that would go through the HR channel, and then that would be officially communicated to the employee. Quite honestly, if I were that employee, I would want that in writing, that you told me I had to come back, because I would be preparing for if something happens to me, that like I've protected myself. Like, I think that's just a reality that we can't ignore. That if my doctor, and I get it, we do have the Dr. Joes or whoever in the strip mall that we may question, the validity of that doctor's assessment. But I think for the most part, this isn't something that people are playing with. We are going to have a few bad apples that may try to manipulate the system. But I think for the most part, people are coming in. This is a legitimate note, and we're going to need to try to accept those. Now, I understand from the administrative perspective, they're probably juggling staffing needs, shortages, all this other goodness that's going on behind the wall or behind the scenes. But that's not really that employee's issue. It's just not.
I agree. Does anybody else have anything they want to say? It was a hot topic. If not, I got 2 more updates. Well, 1 more update. And then I want to have one last personal question that was sent our way that I did promise we would answer. So real quick, I just want to mention that we have 4 Texas prisons on lockdown due to the possible COVID-19 exposure. I actually like that. At least they're getting right into that lockdown. I saw that in, I think it was Northampton federal system. So I believe that lockdown is what we do for safety and security when there's a threat, especially if it's an unknown threat. You lock it down. It gives us time to contain it, figure out what it is, and work with it. So for facilities right now that aren't locking it down, that are trying to deal with this threat, you're making it harder. I mean, you really are. But we talked about the lockdown. I just wanted to mention that. And then also, just another idea, PA inmates making masks, soap, disinfectants to slow the spread. So obviously there are a lot of places that have limited resources. So a lot of facilities have stepped up. Pennsylvania leading the way with using the inmates to go ahead and make what's needed. So Pennsylvania State Prison inmates have produced nearly 200,000 cloth masks that are being worn by prison employees and inmates during ongoing COVID-19 pandemic. Corrections Secretary John Wetzel in mid-March directed all DOC employees and inmates to wear masks, a measure recommended by state and national health officials to slow the spread. As a result, Pennsylvania Correctional Industries, the DOC bureau that employs inmates to produce various products that are sold to nonprofits and government bodies around the state, retooled production at its garment factories to focus on making cloth masks. We didn't want to take from the community supply, Wetzel said, so we began making the mask in-house at several of our state prisons. Since March 17th, inmates have made a total of 185,136 masks, many of which have been or will be distributed to all DOC facilities and offices, including parole agencies. DOC employees have been provided with 3 masks each, and each inmate has received 2 masks. In addition, over the past weekend, some of the masks were shipped to other essential state employees at the request of Governor Tom Wolf. Inmates are working 12-hour shifts 6 days a week to produce the mask and other coronavirus-related items, including 36,000 bars of antibacterial soap, 255 gowns, and 1,620 packs of disinfectant per day. Now, Connie, I would assume that when they make this stuff, someone from medical is checking on it to make sure that they do provide the protection needed?
I'm sure. I mean, I would assume that before it even gets to that point, that there's already been some sort of standard of or quality check on whatever fabric they're going to be using, whatever materials they're going to be using, because they usually make sure that they check to see if something has a fire retardant in it. They check for tons of stuff along the way, as well as the filtering of it, and really the quality of the fabric. And there's a lot of resources out there now really talking about what types of fabric you should be using and all that other stuff. And I mean, I also noticed that in Arizona, I think they have like almost 8,000 masks that they produce, and they're supposedly giving them 2 to each officer.
Yeah.
Yeah. So, I mean, kudos to those who are being proactive and actually doing that.
Now, would anybody like to comment on this at all? I mean, I think it's a good idea if you have the resource in your facility. It's a great backup plan. Would anybody like to comment? Because after this, I got that one personal question. I was hoping that we all could comment on that, and I'm going to give it back to the person who asked me. So does anybody want to comment about the making of the gear in PA? All right. So, guys, this is the last. Oh, I'm sorry, you did?
Sorry, I could just give a input here. So I've learned a lot about these masks and the materials that are needed to actually make them in the last couple of weeks. So my alter ego is I supply government agencies with, different materials and whatever they need. This is a totally different thing for me personally. However, I've learned that most of the materials that they're making these things out of aren't N95 compliant, and at the most may have some sort of a nylon or some sort of filter in them, if any at all, if it's not just the material. Here in Arizona, they're just materials. So the problem is that virus transmission is only basically stopped with an N95 grade mask. Now, there are some Chinese imports that are not as effective as American masks currently on the market. But if that material isn't effective at filtrating down to 1 micron, it's really not doing anything for the transmission of the disease. So, that is a factor. If they're not using the correct materials, it's kind of a false sense of security, if you ask me.
Would you agree with that, Connie?
I would. I mean, I would like to think that, they've got a standard for how these masks are being made and that they are in compliance. But I would also imagine that, for systems that are already low on resources, I don't know how much investment is being made into material for these masks that are being made. So, I mean, I would question it, but I do agree with Brian.
Well, actually, you know what? Maybe that's a good question we could put out there to our audience. Guys, if you watch it and you're coming from PA, you're coming from facilities that are making these masks, we're very curious to see what material they're using to make the masks. That's just good information to get out there anyway in case other facilities decide to adopt them. We want to make sure we're doing the right thing. So great point brought up by Brian, who actually, I believe he's working like crazy to make sure that he can get masks out to the many agencies. And it's a lot of work because he has to make sure he wants to make them as cheap as possible. But of course, you have to order a lot to make it as cheap as possible. And I know that takes a lot of work and it's needed. So Brian, I appreciate that effort. I know Brian's a big fan of what we do in corrections, he himself being a warrior. So everything he's doing is because he knows it's needed. And kudos, hats off to you, Brian. We appreciate you. All right, so I'm going to ask one last question. And I was hoping we all can give a response, and I'll go ahead and give it over to the person that sent it to me. So, and they really need our help. So, hey, Anthony, I work for the Illinois DOC at the Pontiac Correctional Center. We have confirmed case of COVID-19 on our medium security unit, which is located approximately 50 feet from the max unit, which is where I work. And some staff, particularly our food service personnel, is back and forth between the two. All day. And we have several suspected cases inside the max unit. According to all information posted on the department website and being given to the public, both units are on full lockdown, which again, according to the website, means no movement except for medical care. However, we're still running virtually every type of movement that you can think of. This includes mental health therapy groups that place multiple inmates in a room, in some cases no more than 12 to 15 feet square with the mental health therapist. We have also been running individual mental health interviews that place a single inmate in an enclosed room due to privacy concerns with the mental health therapist. These rooms are often no bigger than 8 to 10 feet square. These things were concerning due to the proximity it puts staff and inmates with each other, especially because many of our segregation inmates are required by institutional directive to be escorted by a minimum of 2 security staff. Today, though, the department absolutely blew my mind as the decision was made to run our PC inmates to yard today. To yard. This means there could be over 100 inmates congregated on a yard no bigger than a football field, playing basketball, sharing weights, playing cards with each other, etc. This violates everything the department is saying they are doing to prevent the spread of COVID-19. Obviously, it had to come into the department VIA staff, as the inmates are obviously not going out in the public, but seriously, this has to be one of the dumbest things I've seen the department do. The union challenged the decision first thing this morning, and obviously the department said running the yard was okay. We as free citizens living in the public are not being allowed to gather in groups, go to parks, etc. Yet the Illinois Department of Corrections is blatantly disregarding all concerns for the public safety and the inmates in their charge. They are putting the staff and our families at elevated risk of being exposed to COVID-19 and granting more rights to the inmates than the members of free society have right now. Our union's doing what they can, but our administration doesn't seem to care. What advice do you have for us as to how to bring this to light without violating any of the department's rules regarding posting about the department's dealing on public social media? Obviously, I must be kept anonymous in this situation as I need my job. Again, I appreciate all you do for our profession. So what I thought we could do is I'm going to go with Brian and then work our way back. Brian, Darryl, Connie, Piper, and Lou. Again, this is someone that's been following the show for many years, and I want to be able to give them some good advice, and I think we're a good panel to do that. So, Brian, you want to go first?
Well, it's pretty concerning that they are allowing inmates to go out and, enjoy recreation at a time like this. I would think it's also like on the inmates and that they wouldn't want to be getting sick. But on the flip side of that, I guess if no officers or inmates are, contaminated, then they're kind of not going to get it. However, how would you know that? Because officers are getting, they're testing positive from outside sources, not necessarily inside sources, right? And the only way that it's going to get brought into the system and brought into the units is from the officers. The inmates aren't going anywhere. So, yeah, that's pretty concerning to me. I don't know who's making that decision, but I'd love to hear Connie's response on this, though.
Okay, so we'll go to Connie first, then Darryl. So, Connie, what's your thoughts?
I mean, it makes no sense to me at this point. I just can't imagine that this is being allowed to happen. I mean, I understand the importance of, especially right now, having mental health treatment for those who are severely mentally ill, because therapy is essential. And for those who have high anxiety, they have depression, so I get wanting to continue certain services, but it just doesn't make sense at this point. I think that if in fact there was maybe a group room or something, that if there's a need for treatment, that provider could take that individual into that room and it be still within the confines of, their housing area or something. I can't imagine having that kind of movement for any reason at this point.
I agree, by the way, Connie, 100%. Darryl, what's your thoughts?
Yeah, I have to agree with both Connie and Brian. It doesn't sound to me, based on what we were heard here, that was a good decision. Again, we have to go back to what we've been talking about all night is you can't see it. You don't know who's positive. Any of the staff involved in any of that movement could potentially have it. Any of the employees. And once you start moving people around, like Soto said earlier, the disease doesn't move, the people do. And when you move people around, you're going to expose others. And it's just, I hate to see what happens at that facility in the next 2 weeks, because it could be very bad. And
I'm sure he'll let us know. He keeps us informed, obviously, because he trusts us. You know, he trusts the advice we give. Hey, Greg, it's the same topic, but I want to make sure we cover that last part of his question where he says, what advice do you have for us as to how to bring this to light without violating any of the department's rules regarding posting about the department dealings on public social media?
Well, obviously, you know, this is kind of social media. So, you know, sometimes you have to be, pardon the expression, you got to be deep throat. You have to bring it to light in some way. You have to sacrifice yourself a little bit, fall on the sword. We had, in my facility, we had an employee advisory committee. You know, we had a group of employees that came from all different facets of the facility that could sit down with administration and cover issues from time to time. I'm sure you can go to your captain. It's one simple word. I think that the reason the facility administrators are making the decision to go ahead and send these inmates to rec, and that's liability. They are worried that the inmates are going to maybe sue them for not getting their rec time. But Lou has mentioned it, Brian has mentioned it, under extreme circumstances, you can lock the whole facility down. You can lock everybody down, hold them in place for, you know, several days if there's an emergency, and clearly this is an emergency. But the officer needs to follow that chain of command. I know that this is not the answer exactly he wants to hear, but you got to run it up your flagpole. You got to give the opportunity to your supervisors, captain, majors. You got to give them a chance to try and work for you and with you. I know that several of the people on this panel were administrators in facilities. We have to give our chain of command an opportunity to work. And you got to run up the flagpole, and you got to keep banging on that drum until somebody listens.
And you know what impressed me the most about today's dialogue actually was, did you know going into that dialogue, Greg, that liability was 5 syllables?
I actually tapped on the table a few minutes ago to make sure I knew it was 5 syllables.
That was pretty impressive, man. All right, I'm just asking. Hey, Soto, do you mind commenting on that? Like, basically, what measures do you think they could take to kind of get this concern out there? They feel trapped.
Yeah, they feel trapped because, you know, you feel like you know something's not right. You feel it inside. You feel it. You know that something's not right, that something's going awry. And you want instant gratification. Sometimes you want to fix it right away. And unfortunately, in our business, it doesn't happen right away. These are slow turning wheels. But just like, you know, running it up the flagpole is one way. Obviously, you have to do that. Give them the opportunity to rectify their own mistakes sometimes. But also, you know, some of our states have unions. Take advantage of the union. You have to call it in and say, hey, this is affecting not just me, but the entire union membership. Help me out. You have to represent me. And I think that something is not going straight, not going the way it needs to go. So those are the things. And he's already reached out. He reached out to us. He reached out to Tier Talk. We're putting it out there, right? We're going to probably put it out there to the rest of that state. Hey, listen, if you know something's happening and something is wrong, voice your opinion, right? Do not violate policy or, you know, your department's policy, because they're going to tell you it's contingent upon your employment, and you've signed several things that say, hey, I will not speak ill of my department or anything of the sort, but it doesn't stop you from using other avenues to get your point across, all right?
Right, and by the way, we do put the information out there, and it's up for people to share it. Like, we had the wives of the New York COs on, and they shared it like crazy, and then by the next day, change happened, and the young lady called me back, and obviously it's really their passion, but they thanked the venue of Tier Talk. The New York COs thanked us because of what we were able to provide. But again, we put the message out there. They have to share it. I actually want to add a thought to our boy as well. I told him I'd answer it too, and I think we all agree with this is, you know, obviously document everything, but hold people responsible. Don't just say administration. Put somebody's name in there. Like, I spoke to Soto, because now Soto's going to think like, well, holy shit, now you just used my name. And then you're going to find your Soto's going to fight for it because, hey, guys, they're throwing my name under the bus. And I know that because I've been on the other side of that, where, they make it more specific to, hey, Gangi, just don't forget, I'm telling you this problem. So therefore, I have no way to diffuse that level of responsibility, which motivates me to act. But I will tell you something. If at that point nothing happens, I'll be quick to say, hey, wait a second, guys, I passed the information up. So at least you got to document, and you got to find somebody that is in a position to sorry, hold on, guys. Let me just find somebody that's in a position that can do something about it and put their name on that. Now, guys, do we have anything in closing? We'll start with Brian and work our way down to Lou.
No, my only thing, you had mentioned I'm trying to get masks out to people. So if there is anybody that is trying to get a hold of that, I'm not selling them. I'm not making them. I simply have access to a company that is. So I'm passing that information on to agencies. It is for specifically first responders, corrections officers are of course included in that. But police, EMS, fire, that's all included, and medical. So that is something that I'm working on. If anybody is interested in that or needs to get a hold of me, you can find us at Talking Guns on Instagram, Facebook. I answer since it's mine, so feel free to contact us there.
Right, and you're saying Talking Guns, TALKING?
GUNS, yes. Talking Guns, yes.
All right, guys, so if you get a chance, please check that out. And I know we actually posted something before, and you guys did get some hits, so we know that I do have a pretty active audience. I'm finding that out.
That is true. There was some interesting attention that came from it.
Yeah, that was pretty cool. Hey, I thought that was pretty cool. That means people watched the show.
It was immediate, too.
A little side story, guys. I posted something that I really shouldn't have. I kind of jumped the gun, but thank God they were able to kind of work it out. But as soon as I posted it, the gentleman that's in charge of making it got hit by a lot of people. And so it goes to show you that I do have a pretty active audience, and that meant a lot to me. So I was smiling as I pissed somebody off, but I was happy. But obviously, thank you for the dedication. Also, thank the gentleman who's doing it, because I know it's not about the profit for him. I know this is a mission for him, and we appreciate him.
Yes.
Darryl, you have anything in closing?
Just going to tell everybody, be safe, stay strong, and stay safe.
Hey, Darryl, before you go, can you just mention your organization again?
Sure. We're the International Association of Correctional Training Personnel, IACTP.org.
Yeah, guys, you got to check out that site, guys. They do offer a lot of great training, but the cool thing is, guys, is they go to us to see what type of training are needed, and then they try to build conferences around what the front line needs, what the front line wants.
Next conference is in September. Going to be in Portland, Maine.
Yes, I'll be honest with you. I may be able to attend that now because I wasn't able to go. I was supposed to speak at a bunch of us here. We're supposed to speak at the Nebraska conference, but obviously it's been rescheduled. Then we were supposed to speak at the Kansas conference or Kentucky. It's probably not going to happen. So now we have the Maine one. So I may have some time. I may be able to go to that with my panel.
That'd be great.
And it's in Maine, so I could drive up north, pick up Connie in Connecticut, and we'll shoot up to Maine. Soto will come, right? Just Soto, you got to drive 40 minutes up north to me. I'm not going out of my way. All right, Connie, we got anything in closing?
No, I just want everyone to just keep universal precautions. Please just remember to just protect yourself no matter what. Protect yourself, and any opportunity you get to wash your hands, please do that. Hand sanitizer is good, but hand washing is best.
Hey, Connie, real quick, you have a civilian training business, correct, where you teach civilians kind of how to work in the field of corrections?
Yes. So Civilian Corrections Academy, specific for civilian employees working in corrections, really just touching on all of those skills you need to appropriately engage with the inmate population, manage some of the prison politics, and really deal with the bureaucracy and role ambiguity that's associated with being a civilian and not an officer.
And I think it's a great training, by the way. I learn a lot from you every time we speak. So I'm honored to have you on the show.
Thank you.
Yeah, always a pleasure. Hey, Piper. Hey, it's your first time here. You're no longer a virgin, if I may say. I'm actually, I thought this was great having you. I've been supported by a gentleman named Ken Daly for over a while now. We're actually working on a documentary about a fallen hero named Megan Callahan. She was a sergeant that was killed in North Carolina at Birdie Correctional Facility. We're still in the process of finishing up. We have to wait for the court date of the inmate that took her life. But I'm going to tell you something. This project is very well done, not cheap. And Ken's doing it because he believes in the mission and he believes her story has to be told. And this gentleman got into the business of working in jails and prison because he knew that, you know, we were forgotten heroes. And the funny thing is that he's so impressed by us. Like, if you ever had an avid fan, like, he's a fan of this profession, and he's just interested in what we do, who we are, and the respect he has given me, which obviously I'm able to travel. I'm able to, you know, put that respect forward into the profession, means a lot to me, especially in a world where I don't think people recognize us for what we do. I love to have someone from the outside like Ken to say, hey, Gangi, breathe for a second, because I appreciate you. And I learned it's about quality, not quantity, especially through Ken. But hey, Piper, first off, thank you for coming on board. It's the first time we had you on the show. But what's your closing thoughts?
Well, first of all, I want to tell you that if you ever get a chance, anybody gets a chance to meet Ken Daly, he makes me look low key. So just tell you the kind of guy Ken is. Second of all, if you do get a chance, go to our YouTube page, Guardian RFID, or GuardianRFID.com. Look at our videos. We have several videos about different departments, different facilities, different agencies out there. We have a videographer that is doing a fantastic job. So we really are trying to have a different approach. We don't want to be a private sector company that's all about the dineros. We want to really give back to our brothers and sisters behind the walls, because it's a huge area that needs support, that needs interest, and it needs people to pay attention to it. So you'll also see some videos of me. You know, you can ignore those or watch them if you want. But one of the things every one of my videos, I've been doing this for almost 3 years now with Guardian. I've been a trainer forever. And I have one very important rule, and I end every video with it, and I can't stress it enough. It's get your team home safe. And I can't think of a more appropriate rule for right now than get your team home safe.
I love it. Thanks, Greg. And I want to add one more thing before we go to Lou. What Ken is doing with some of the money he gets from his company to really spend it on a film to tell the story of one of our fallen officers, a sergeant out in North Carolina. Could you imagine how much of a gift that is? And especially for me to be a part of it, Ken gives me a call and says, hey, Gan, this is what we want to do. We don't want you promoting the company. We just want you to tell us, what do you want? How can we help you in this profession? And the first thing that came to my mind is, I don't know what it was about Megan Callahan, but I wanted to tell her story. And when we went out to Rhode Island and North Carolina and we saw where this story was going, but also I know for a fact it's not cheap, and he's just willing to put up whatever it is to tell her story. How do you not want to embrace that? You know, so again, Ken, if you get a chance to watch this, it doesn't just mean the world to me. It means the world to the panel and just to the profession, but definitely Megan's family, you know, so very powerful. And I can't wait for it to get released. We're looking around January of 2021. So almost done. We just have to wait for the court case. Hey, Soto, any closing thoughts?
Well, yeah, guys, listen, what I want to say to you guys is we obviously need to be safe. But we are learning some things as we're going through this COVID-19 crisis. Like I said, I've been working in the city of Newark for the past 2 weeks. I was able to help mitigate some real live cases in this facility, which I would like to share. And maybe this will be another show we can do where people can please, if you're going through it and you're learning as you go through it, share with us your best practices. Share with us what works at your facility, maybe what mistakes were made so that other states can benefit from how we're dealing with it here in our own little world. So please, I'm willing, I'm able. I know that I'm going probably next week to a different facility that's having problems that started to arise, and I'm going to use the same tactics because they're working. They're working, and I know that we can do even better. So again, be safe and stay safe for the rest of the year and the rest of your career.
Well, hey, be advised, Soto, if you want to submit me an independent video on that, I'll post that immediately, and then maybe we could start a trend on other people submit. I'm sure Greg has some contacts. Brian definitely does. We could start some video submissions and really get that out there. So guys, in the future, look for that. We'll probably get that as soon as we can because it's needed rapidly. That's why we've been doing this stuff every day. Hey guys, by the way, did you know that Soto was my training officer? Just figured everybody should know that. I'm only saying that besides the fact that I learned a lot, I'm aging him. You know,
Don't blame me. Don't blame me for what you do now, man.
Oh, I make a lot of bad choices right now. But guys, just in closing, guys, obviously everybody that came on this panel today came on their own time because they know right now we're in desperate times. And if we could just do something to help, this is it. This is getting the information out there by experienced people and just sharing it in the hopes that someone listens. You know, but again, we put the information out there. It's up for you guys to share it. We're good on our end. We're doing what we have to do. And again, tough times right now, but I know we'll make it through. I told somebody the other day, you know, it's tough for me right now because I have to motivate employees to come in that truly are scared, and it makes total sense for them to be scared. But I think good management right now doesn't promise them that everything's going to be okay. I think what good management does is they look at the inside of the person, find the courage, and bring that courage out. And I know for a fact each one of us have that courage. I wish I could say be okay. I can't. But I can tell you is that you have the courage inside of you to come in every day, stay motivated with the mission, and we'll get through this. And when it's all said and done, we'll go back to those conferences, we'll share some drinks and just live life. And then finally, we could have shows about how do you deal with bad supervisors. You know, we could go back to the usual topics. All right, guys, as always, the show is Tier Talk. If you haven't, please subscribe, interact, engage, comment, hit that bell. That bell's going to notify you every time I post a video. Stay safe.